Another important skill is to use to be able to apply a sling and swathe. The sling and swathe is used to secure the upper extremity against the body and to support the injury to either the upper arm bone here, upper humerus, potentially a fractured upper humerus, dislocated shoulder or humerus. It can also be used to support a fractured forearm or Colles type fracture here. And so we're using the triangular bandage. So we take the triangular bandage out and basically it goes under this elbow and then cuts across so that we can provide this support. And as we tie the support, we want to draw the tails in at the top end so that it allows us to release the weight so that it distracts the weight from this area, so it's no longer putting all this weight and causing injury or continued pain and muscle spasm to that injured area. So that would be the first splint. So we would go ahead and help and support the arm. We'd go ahead and find our tail on the triangular bandage. This would be the center tail. We'd make a little knot, place the knot over the elbow, place these tails over the patient so that we can draw this up. And so we'll end up drawing the tails up evenly so that it provides enough support. What we also want to do is to make sure that we leave exposed the fingers so that we can check the distal parameters. Now when we tie this knot, we want to tie this knot in areas that potentially won't irritate or aggravate our patient. Common areas that we'll find will be just above the clavicles on the anterior surface, because what we don't want is this knot to then sit there and irritate the person's back of the neck. So we're moving that knot and we're trying to put the knot somewhere here and we're drawing up on the tails. Now this is supposed to provide our support to keep that arm from dangling downwards, so we're supporting all of that. The second portion of this is the swathe. The swathe, we take another triangular bandage, the center of that triangle will tie a knot. This knot goes over that shoulder area and it'll come directly across. So basically what you're doing is you're securing and fastening this arm. It's almost like anatomically splinting the upper extremity to the torso. So we would place this knot over the top, try to make sure that we keep that arm exposed. We would have our patient lean forward just a little so that we can get the other tail from behind them. And we go ahead and pull this tight. And this knot again is going to go on the side of the patient. So that this again is causing us to release the extreme pressure from the weight of the arm dangling down. It's also then securing this arm to the torso so that it's more like an anatomical splint, so that we can't lift this arm up and there's very little movement there. Again, we want to use RICE therapy. So I hope you remember what we said RICE therapy was. R stands for rest. I stands for ice compression, which we would place over depending on where this patient has injured. If it's over the forearm area, we place it here. Up on the shoulder, we place it up here underneath the sling and swathe. And then E is elevation. So we basically want to just elevate it just slightly above the level of the heart. And in this case, we've sat the patient up. And so this is providing some of that elevation. Check your distal parameters again once this is all connected up and done for. And our distal parameters or CMS is circulation, motor, sensory. I also use something called pulse, motor, sensory, temperature, skin color, and movement. The other people also use PMS, which is pulse, motor, and sensory.